Obesity is one of the fastest growing drivers of cancer. It's linked to at least 13 different types. Health experts warn it could soon surpass smoking as the leading preventable cause. The problem is, for many people, losing weight is a tough battle. The good news is small changes can make a big impact. With several locations and just about every doctor you might need, Genesis Medical Group makes it convenient to stay on top of your health. Board-certified internal medicine and oncology physician Dr. David Ellen joins us to explain the cancer connection and how they can help you with some healthy weight loss goals. Good morning.
Good morning.
All right. You're internal medicine, which you manage severe long-term illnesses and complex chronic conditions, but also the oncologist, and you're involved in research as well. The bottom line is when the body is I guess, out of homeostasis is when it opens the door to so many other diseases.
Yeah, absolutely, especially with obesity. Obesity linked to, it increases the chance of cancer by about between 14 to 20% based on a study.
Wow.
Now, there are several reasons why. One of them is, especially abdominal fat, is like a separate endocrine organ. It increases level of estrogen. And as estrogen increases in postmenopausal female, it increases chances of breast cancer. Also, it's what's interesting, it's very pro-inflammatory.
When you say inflammation, because we're hearing a lot about inflammation right now, and I'm not sure that we all understand what inflammation means, but that's kind of your body's warning system that things are out of whack.
Yes, what it happens is that adipose fat, it secretes TNF alphas, interleukins, the forms of molecules that stimulate and cause the inflammation. And inflammation leads to cancer. So that's why we see such a linkage between obesity and malignancies.
Yeah.
And various malignancies, from renal cancer to breast cancer to pancreatic, multiple esophageal, multiple malignancies that are linked to this severe effect of adipose tissue.
So it's almost like that extra weight is like choking out the body where it can't do the functions it needs to keep us healthy.
Absolutely. This is just one side. Then it affects the heart. It affects almost everything in life. This extra weight is disastrous for humans.
Yeah, all right. And the obesity piece is preventable, as are things like smoking, too much alcohol, other toxin exposure, sedentary lifestyle, high calorie processed food. We can control that. However, when it comes to losing weight, easier said than done. There are some actionable things to do. Obviously, adopt a healthier eating plan, do at least 30 minutes of movement a day, and you all can help with the rest. If you are literally obese, the first place you need to start is with a doctor to even know your numbers, see where you are.
Absolutely. BMI is phenomenally important to know your BMI. It's also, you're right, it's very, very hard to lose weight. Very hard. And when somebody just is telling you just lose weight, it's purely annoying.
Yeah.
It has to be a plan. It has to be a plan how we do it. In fact, losing weight involves not just cutting out the food. What kind of food do you eat? It's very important. You're right, ultra-processed food is not good for us.
Yeah. In fact, you mentioned something about hormones earlier, and so hormones are one of those things where if you lost weight easily in your 20s, let's say, for example, and then all of a sudden the same thing you did then to lose weight you're doing now is not working, and if you have type 2 diabetes, that also kind of puts a roadblock in trying to lose that weight as well.
Yes, because this insulin resistance, it blocks it. And it's very important to have the team approach in losing weight. There should be some form of exercise, usually muscle building. It should be what kind of food you eat. Maybe you need additional medications like semaglutides. But you don't just take semaglutides and you have to have a process.
Yeah. And when you say semaglutides, that's the whole thing that people are hearing about, GLP-1s and the whole bit, which has really been groundbreaking in helping people to lose some weight and manage their diabetes. However, it's important to do that with a doctor's care. And so when you prescribe that, you're also watching to make sure it's the right dosage, because what happens when people don't have the right dosage?
You're right. There's phenomenal effects on the gut. There could be effects on the eyes. There are other side effects. There is no free lunch.
Yeah.
But more importantly, as you lose weight with semaglutides, you have to make sure, let's say you have to do muscle exercise, because otherwise you have that Ozempic face.
Yeah.
Who wants that? So you want to make sure that you have the form, you have the proper supervision.
Yeah, because otherwise you get that muscle wasting, and then that causes other issues, right? You also make us kind of a partner, because I think a lot of times we'll go to the doctor and say, here, you tell us what to take, and I'll good. You make us a partner in it. You could even do something like prescribing the glucose monitors, so we know what foods do we put in our mouth that spike our blood sugar.
You're right. you're not just a part of your family. At Genesis, patients are family.
Yeah.
And there are the doctors and nurse practitioners, the providers, they trained in the obesity medicine.
Yeah.
They trained how to approach to losing weight, what monitoring is needed. Losing weight.
What to eat, you know, because like if we ask the questions, oh, I thought this would, no, we could tell us what foods are good for us.
Inconsistency. Losing weight and then gaining weight doesn't do anything except maybe you can lose gallbladder. You have to be consistent.
Yeah.
Consistent in the weight is lost and keep the weight off.
Yeah.
Keeping the weight off is probably even more difficult than losing weight in the first place.
Yeah, and we are epidemic proportions when it comes to obesity. All right, you mentioned that when we come into your offices, we're like family. Genesis Medical Group can treat the entire family, and kind of how you came about, it was a purposeful effort by top doctors in every health field to say, let's put everything under one roof so that, you know, the kids can come here, you have pediatric care, you know, grandma can come here, you have geriatric care, you have all of it. And when you have all the specialists, because sometimes we'll have more than one, I think one of those irritating things is when you have one issue, you have to go over here, another issue, you go to this other place across town. Everything is under one roof. If you have diabetes and arthritis, guess what? You have doctors under one roof who can treat
You're
that.
absolutely right. And more importantly, doctors talk to each other. The biggest issue we have, somebody does something across the town, and here we don't even know.
Yeah.
What
medications are you taking? Making sure that your medications are good together.
And then there are conflicts in terms of medication, in terms of what is prescribed. So communication between doctors is paramount.
Yeah.
It is important.
And you have general surgery, cancer screenings, orthopedics, and also we can go ahead and take care of urgent care needs there, and in-house lab test. Again, you're not having to go around town to get that information. It's right there under one roof, and your records also stay under one roof. I challenge anybody who, if you've not been to the same place over years, where are all your medical records at? Mine are all across the country, but now they can be under one roof. Dr. Ellant, thank you very much.
Oh, thank you. Always a pleasure.
All right. To book an appointment, call 281-440-5300. Again, that's 281-440-5300, or visit genesisdoctors.com. You can start with your primary care doctor there, and if you need specialists, again, they have them all under that one roof.